Do you have knee pain that might be located on the outside of your leg? That sometimes is worsened with things like jogging, running, biking, or even going to bend and pick something up from the ground. Then you might have what we call ITBand Syndrome, or sometimes referred to as runner's knee. Today I want to explain to you what that is, how do you know if you have it, what you can do at home to help it, and when is it time to go seek a medical professional. If you like this content and want to learn more, please visit us at physical.com/Hazelton and like and subscribe to our YouTube channel. Hi, Anthony here from Physical Therapy and Balance Centers of Hazelton, and today I'm going to explain to you what is this ITBand syndrome. So, ITBand syndrome, or runner's knee, is inflammation of a connective tissue that attaches to the outside of your knee, which is where you're going to feel the pain. So this occurs when there's excess rubbing of that tissue on a bony landmark that it attaches to. This is a lot of time caused because of overuse activities, just like running and jogging, usually more outside than inside, things like biking, or even repetitive bending up and down if you're not used to it. So you might be dealing with this kind of pain or this problem at the knee joint if the pain that you're feeling is kind of locally located right on the outside of the knee. You could almost pinpoint it. You could touch it. It's painful to the touch. It might be sharp, especially during the activity, like running, jogging, biking, or even getting up and out of a chair. And a lot of times it occurs during the bending motion. Once your knee starts to go, below a certain degree point, you're going to start to feel that pain and uncomfortable feeling on the outside of the knee. So if this sounds like something that you might be dealing with, well, what could you do at home to help? So first and foremost, I like to tell my patients, try heating the area before your activity. By heating the area, you'll be able to loosen some of the tissue, get some blood flow to the specific area. You could also ice afterwards. By icing, you'll decrease any inflammation to that area, hopefully reducing any pain. You could also do some specific stretching of that IT band or massage of that same area. After you've done things like that, well, you could strengthen. More specifically, strengthen the hip abductors, your hip external rotators, and your hip extensors. And then avoid any provocative activities, especially walking or running outside on uneven surfaces, and then slowly reintroduce those activities after pain has subsided. If you're still having pain even after trying some of these home remedies that we explained here, it might be time to seek the advice of a medically trained professional. What we can do is better assess the area for different complications. We can use our diagnostic testing to look into the knee joint itself and rule out different conditions and even tell you how bad the inflammation or damage to that specific tissue is. So if you're having 8, 9, 10 out of 10 pain, it hurts every time you walk, get up and down from a chair, or even use your stairs, it might be time to seek a medical professional. Please try some of these exercises at home. And if you have any questions or complications, please feel free to contact us at Physical Therapy and Balance of Hazelton.